The legalization of marijuana is causing concern for doctors across the state.
There are health benefits for using medical marijuana, but if your heart could be at risk when it comes to recreational marijuana. For more, we welcome Dr. Christine Jealous, cardiologist with the Cleveland Clinic. Welcome back.
Thanks for having me.
Oh, great to have you.
Nice to meet you.
So when you talk about recreational, obviously there's been a legality that has happened here in the state of Ohio. More people may be using, but they may not be using the recommended amount that they would have gotten from medical.
I think people are falsely reassured, really, now with the legalization, and I think it's up to 24 states and DC that people can use marijuana for recreational use. But what we're seeing with some of the studies, and in particular a recent study on nearly 500,000 people, is that there is an increased risk for stroke and heart attack in people who are consuming cannabis, both via the smoking method, but also vaping, eating as well. Which is a bit concerning and something that I'm sure a lot of people hadn't really been aware of or even considered now that they're thinking about their options around the use of marijuana.
Right. So the cannabis and tobacco, are they all that different?
Well, I think there's different components to it, but what this study showed was that the risks for stroke and heart attack were actually over and above the risks of tobacco, because some people in the study were cigarette smokers as well as using marijuana. So there was an increased risk on top of that baseline risk, which I think would surprise some people, but also the particulates in the marijuana joints, if you like, can also impact on health from a pulmonary perspective and potentially have other cardiovascular impacts. So although it's a little bit of a Debbie Downer thing to say at this time of year, I think people need to be aware of this and make sure that they're honest and transparent about their use of marijuana with their healthcare providers. Those conversations are always in confidence, and it's best that we know what people are using so we can help support them and mitigate against their risk for cardiovascular disease.
It just seems counterintuitive to think, because it's such a relaxing type of drug, that it wouldn't have any effect on your heart, you know, when it comes to that.
What's the particulars in that? Like, what is it doing?
Well, I think there's some different theories around this, probably related to what we call endothelial activation, which you can think of in a way of inflammation. So it might be activating platelets, which can then contribute to blood clot formation, which can increase risk for both heart attack and stroke. It could also be that it increases risk for atherosclerosis, which is that cholesterol deposits within the arteries that we all accumulate over our lifetime. But perhaps if you're smoking more marijuana, it's going to be at an accelerated or a higher rate. So it's really important because this is dose dependent. So for people who are using more than others, their risk is actually higher. So we need to get the message out there that it's like everything in life. Everything in moderation, of course. As a physician, obviously I would prefer people not to be using marijuana, but at least if folks choose to use it, now that it is legalized in some states, they should be informed of the risks so they can make choices for themselves about their health now, but also in the future.
And what's the age group that we're looking at? Is it more the younger generation now? Well,
I think the use is mainly within the younger generation, but this study did go up to the age of 65. So that dose-dependent relationship was seen across the spectrum of ages. So obviously as we get older, we accumulate other risks for cardiovascular disease, diabetes, obesity, and so forth. So we see more heart disease in people as they get older, but for those who are younger, they can be proactive and do things now that hopefully going to stop them having to come and see me in 20 or 30 years.
Yeah, we love you, but we don't want to see you.
Marijuana not the only thing that can impact the heart. You're going to be talking on New Day about something else as well.
Absolutely. So we're going to talk about alcohol over the holiday season.
No alcohol, no marijuana. Shut it down.
I'm such a Debbie Downer
It's
today.
okay. You're trying to save us.
One day at a time.
And obviously alcohol can increase during the holiday months as well. So yeah, something to think about.
Absolutely. And we'll talk about that a little bit more. But there's some pretty cool mocktails and things around now that you can have, so it doesn't all have to be doom and gloom over the holiday period.
Mix in some water.
Exactly.
Dr. Jealous, thank you so much.
Pleasure.
And we'll see you on New Day coming up in just a little bit with
great job.
David and Natalie.